Cysts can be categorized by those cysts formed by developmental remnants, those that arise from tissues unrelated to tooth development, and pseudocysts, lesions that appear to be cysts but by definition are not cysts. Let's review the definition of a cyst. A cyst is a closed sac with a definite wall, which can be filled with fluid, semi-filled with fluid, or solid substances. Odontogenic cysts are those that arise from embryonic elements. The dentigerous cyst is also considered to be a follicular cyst. Its source is the reduced enamel epithelium. It is a well-defined radiolucency discovered on radiographs and is usually asymptomatic. When it is excised, it is fluid-filled, and the most common teeth involved are impacted third molars, as is the case on the panoramic that you see on the right, maxillary canines, and second premolars. Notice too the displacement of the third molar due to the dentigerous cyst. A primordial cyst is a well-defined radiolucency found in radiographs and is asymptomatic. It's probably most common in the third molar area, and usually the tooth is missing, and it's not usually associated with a tooth or an unerupted tooth. The lateral periodontal cyst arises from epithelial rests or remnants in the PDL. It is asymptomatic and usually appears on the buccal surface, on the lateral surface or the buccal side of the jaw. Odontogenic keratocysts are one of the rare benign lesions that grow aggressively and have a high rate of recurrence even after excision, very much like malignant lesions. They arise from the dental lamina. They are a well-defined radiolucency, again discovered on radiographs, and are asymptomatic. But they are highly aggressive and, as mentioned before, even with excision, will recur unless they are very carefully excised. The other alternate name for the odontogenic keratocyst that you may see in the literature is keratocystic odontogenic tumor. Eruption cysts occur in children. It's caused by the separation of the dental follicle from the crown of the tooth and is usually fluid-filled. It is sometimes called an eruption hematoma because it is bluish, because it is blood-filled. These cysts are self-resolving when the tooth involved erupts. A gingival cyst arises from dental lamina, usually occurs in the mandibular canine and premolar area, and it's sort of a soft tissue version of a lateral periodontal cyst. When cysts arrive without developmental origins, they usually arise from remnants of tissue, especially epithelial remnants. The cyst of the incisive papilla and the nasopalatine duct cysts are often used interchangeably. The name is given by location. The cyst of the incisive papilla is used or can be used when the cyst occurs on or near the incisive papilla. When the cyst occurs in the nasopalatine duct, it is called a nasopalatine duct cyst. Some cysts are easily distinguishable by their location. So it is with the globulomaxillary cyst. Globulomaxillary cysts occur between the maxillary, lateral, and canine. It arises from epithelial remnants, and it arises only between the lateral and the canine. It may cause root diversion, as you can see on the radiograph on the far right. The roots of the canine and the lateral are beginning to diverge. They arise spontaneously, or sometimes there's some irritating factors that may cause the globulomaxillary cyst to arise. As you look at the following three cysts, please note that the location of these entities are distinct and sometimes aid us in diagnosis. The thyroglossal tract cyst is congenital. There usually are epithelial remnants in the duct, the thyroglossal tract, that is the tract that took the thyroid from the base of the tongue embryonically to the base of the throat. If they occur above the Adam's apple. They usually remain small. They can become infected if they are large, and if they get larger, they will cause swallowing issues. Because the cervical lymphoepithelial cyst involves the parotid gland, it is located on the lateral neck and jaw. It arises from epithelial remnants of lymphoid tissue in the parotid gland. It is the common cause of parotid gland swelling in HIV patients. Dermoid cysts are located in the midline, but usually located either above or below the mylohyoid muscle. They arise from ectodermal elements and may be above or below the mylohyoid. The case on the right is one that is below the mylohyoid. They're asymptomatic, they grow slowly. However, they can cause airway encroachment if they get large, and dysphagia, which is trouble swallowing. Sometimes a lesion appears to be a cyst. By definition, a cyst is a closed sac. Mucoceles and ranulas do not fit this description. A mucocele or mucus retention phenomenon is generally caused by trauma to the lip, such as lip biting. The lower lip is the most common site, but it can occur anywhere in the oral cavity. Most common intraoral lesion. It is the most common intraoral lesion. Again, what's happened with a mucocele is that when the patient bites their lip, they sever the duct for one of the minor salivary glands. You have to remember that there are a lot of little salivary glands all over the mouth. So when the patient bites, they sever the duct. The salivary gland continues to produce saliva and mucus. And so what you're seeing there with a mucocele is the saliva that has been pushed out of the saliva gland but is now pooling in the tissue. That's why it will come and go. The patient will have it for several days, and then the mucus or saliva will dissipate into the tissue and the lesion will go away. A ranula is a really large mucus retention lesion, usually on the floor of the mouth. It is caused by trauma to the floor of the mouth, and the word ranula comes from Latin, which means little frog. Again, it's not a problem. They usually seem to resolve by themselves. Sometimes they need to be excised, and the saliva gland needs to be removed if it causes problem with swallowing and talking. The static bone cyst, or the Staphny defect, is a lingual mandibular bone depression. If you take a look at the panoramic X-ray on the right, you'll see on the patient's left a rather circumscribed area, dark area, right at near or very close to the angle of the mandible. This is asymptomatic. The patient doesn't know it. It's usually something that is found on radiographs. And if you were to go in and take a look at it surgically, you would find that the submandibular gland actually fits into that depression area. So there is no treatment for the Staphny defect. The simple bone cyst or traumatic bone cyst is sort of an interesting kind of lesion. The cause is trauma. We think there was trauma to the mandible. Usually occurs on the mandible. What we think happens is that there's trauma, but there is no hemorrhaging into that traumatic space. In order for things to heal, there has to be bleeding. so that it causes granulation tissue and organization so that the lesion will heal. In this case, we think that it doesn't, there is no bleeding into that cavity. And so what you end up with is literally a hole in the jaw. And that's what you see on the far right, is going in and finding that there's just essentially a hole with no fluid, nothing in it. So generally it's asymptomatic. It's usually something that's found on radiographs. I think it causes problems because it looks like it's so close to the apices, but the teeth are vital. There's really not a problem. So what can be done is the surgeon will go in, create a small space, and scrape the inner surface of that bony cavity. That will cause bleeding. Then that in turn will cause the organization and the filling of that bony space. So essentially, it's not a cyst because it doesn't have a sac that holds it, and there's no fluid or tissue in it at all. Okay, this concludes the lesson on cysts of the oral region. Again, as always, if you have questions or issues, please do not hesitate to let me know.